Before using buprenorphine, individuals should consult their pharmacist for more information. Before taking buprenorphine, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Talk to your pharmacist for more details. If you experience any side effects from taking Buprenorphine Hcl, bulk, powder, it's important to consult your pharmacist or physician. In the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Buprenorphine Hcl, bulk, powder is used to treat opioid dependence and chronic pain. It works by preventing withdrawal symptoms caused by stopping other opioids, and also helps to relieve pain. The dosage of Buprenorphine Hcl, bulk, powder varies depending on the individual's medical condition and response to treatment. It is usually taken once daily. The best time to take this medication is as directed by your doctor. Before taking buprenorphine, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Be sure to consult with your pharmacist or physician before using Buprenorphine Hcl, bulk, powder. It's important to keep a list of all your medications and share that list with your doctor and pharmacist. This will help them ensure that Buprenorphine Hcl, bulk, powder is safe for you to use alongside any other medications you may be taking. When it comes to the uses of Buprenorphine Hcl, bulk, powder, it is commonly used to treat opioid dependence and chronic pain. The dosage of Buprenorphine Hcl, bulk, powder can vary depending on the individual and their specific condition. It is important to follow the instructions provided by your doctor or pharmacist to determine the correct daily dosage for you. As for the timing of taking Buprenorphine Hcl, bulk, powder, it is best to follow the schedule provided by your healthcare provider. They will be able to advise you on the optimal timing for taking this medication based on your individual needs and circumstances. If someone has taken too much of Buprenorphine Hcl, bulk, powder and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call 911 or reach out to your local poison control center at 1-800-222-1222. For Canadian residents, contact your provincial poison control center for assistance. There is currently no available monograph for Buprenorphine Hcl, bulk, powder. However, this medication is commonly used to treat opioid addiction and chronic pain. The daily dosage of Buprenorphine Hcl, bulk, powder varies depending on the individual's needs and medical condition. It is important to follow the prescribed dosage and timing recommended by a healthcare professional. Buprenorphine Hcl, bulk, powder is usually taken once a day at the same time each day. It is important to consult with a healthcare professional for the best timing to take this medication. Before taking buprenorphine, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Talk to your pharmacist for more details. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.